Remember that this video is to help you explore different ways that can help you transfer, either by yourself or with people and equipment to help you. Please work directly with an occupational or physical therapist when trying new techniques. Most of us have a comfortable chair we like for watching TV or reading. Being able to still use that favorite armchair with a few modifications when needed will likely add to your quality of life. Armchairs can be tricky to move in and out of, and that is greatly due to the armrest. While armrests can help you push up from, if you're needing to transfer from the side, they can get in the way. We'll demonstrate a few different methods to help someone transfer to and from an armchair. We'll also explore a few pieces of adaptive equipment that might help. First, consider whether we can add a feature to help our loved one maintain independence. Sometimes adding risers under the chair legs will raise the chair enough to allow them to get in and out of the chair by themselves. While a chair with a very soft base is comfortable, it takes strong abdominal muscles for someone to pull themselves out of the seat. A chair which you can shift your position is perfect. Reclining, riser, footrest riser. Transfer boards are used to help people who are able to use their arms but their legs are weak. During demo, the secret here is to make sure both surfaces you are transferring your loved one to and from are level. This can be a little challenging, but much easier with the arm of the wheelchair down. Now, with an armchair, it is best to use a curved transfer board, or as we call it, a banana board, as it will move around the armrest. Now, let's consider that the individual you're helping has the strength to stand, but moving their feet around is difficult. A stand pivot disc can be used to help a transfer from one seated position to the other. There are many types of equipment for this, but this is easy to maneuver with someone who can stand for this transfer. Now we can look at ways you can help someone without any transfer equipment. It is important that the caregiver protects their back and their shoulders. Look how the caregiver stands to the side and helps from the trunk. They are not pulling on their shoulders. It may be that the gait belt helps you do this. If you can bear some weight in their legs but can't stand all the way up, consider this technique. The caregiver sticks their bottom out as this protects their back. They put their legs either side of one weaker leg or between both legs. Shift their weight slightly forward and then pivot. Notice that at no time does the caregiver lift up. This is where you could get a back injury or a shoulder injury. The caregiver should have their legs doing all of the work. There may be times when you feel two people are needed for a transfer. This could be on days when you are more tired, or sometimes people just need more assistance later in the day. You can see how the second person supports the pelvis and helps with the pivot. When your legs are weak and are at a greater risk of falling, physical and occupational therapists will likely advise you to use a lift. Lifts can be fully powered and manual. We will first show you how to use the powered lift, as the steps are the same for the both. Here we will show you how the caregiver helps the person into a sling. Now, we will roll the lift over. Attach the hooks from the sling onto the lift so the person is lifted in a seated position. This means shorter in the front and longer at the back. Now, we can lift the person up and we can guide them to where they are transferring to. You can then slowly be lowered into the chair. Here's an easy way to maneuver the sling out from under your loved one, so they are not always sitting in the sling. There are multiple ways that you can help someone transfer from an armchair, depending on the type of assistance they need. It's very individual, but we hope this gave you some ideas for how you can help your loved one maintain their greatest independence and to provide ways you can support them while keeping you both safe.